My name is Ruiz Wilfong. I'm an OBGYN. I grew up all over Texas. I lived in Harlingen for several years, San Angelo, Mathis, Texas, College Station, Texas, Fort Worth, and now I'm here in the Hill Country. I've been in the Hill Country for 11 years. I became a doctor after I had worked in a laboratory setting for about 3 years, and I just missed patient interaction. Lab work is very important, research is very important, but the applied sciences. So therefore, being with patients is what really led me to become a doctor. As far as selecting OBGYN, I had actually been volunteering at the Crisis Pregnancy Center while I was doing my work as a researcher, and I just really loved talking to the women about their healthcare in general and pregnancy in specific. So when I went off to medical school, that's the discipline that just caught my attention the most. And I think it's because of the prior experience I had as a counselor. So I really enjoyed it, and the information came quickly to me. And so I thought that would be the best use of my time and my skills. I have been with Peterson Medical Associates since 2012, so 8 years now. At that time, I chose to be part of Peterson Medical Associates because we needed to continue having an OBGYN presence in the community. We were going through a change in our community where our providers were retiring or moving on to gynecology only practice. And so to continue to provide obstetrical care, I wanted to join Peterson Medical Associates because they could support my ability to start that program here, continue it, and grow it. And I found Peterson to be very supportive of women's health care in general. And so that's why I chose to join the group as really one of the first specialists for Peterson Medical. Well, I think what I can offer as far as procedures are robotic surgeries, in-office procedures, but I'm also excited to offer other programs that maybe other offices don't offer, such as our genetic cancer screening. We do a lot of counseling with that, screening of the patients, and we also do the blood draws here. So I feel that we offer a little more than just your basic OBGYN services here. We also do preconception counseling and testing, as well as testing while pregnant for any birth defects. So I think we are a little bit ahead of the game, and we have been for several years. When I'm not at work, I enjoy being with my family. I have 3 children, and they're very active. So I like to do activities with them at home, cooking. My husband loves to cook, so we share a lot of that in common with the children, baking and just cooking in general. And when we're able to, trying to be outdoors, exercising, trying to stay fit. And of course, we like to participate in our church as much as we can and build that community as well. The best thing about being an OBGYN is that it's pretty comprehensive. You can do annual exams, so you can see all ages and talk to them about their particular needs at that stage of their life. So that's exciting because that's primary care. The other thing is, of course, obstetrics. So helping women go through that very exciting time but scary time of their lives, educating them on what's normal, what's not, helping them prepare to have the best pregnancy that they can. And if there are any complications, just explaining to them what's going on with their bodies and what we can do to help them have a successful pregnancy, even if there are health concerns during that pregnancy. So I really feel that OBGYN is a complete package because you get to do primary care education and surgery, which I really enjoy to be able to do those extra procedures with my patients as well. So I see them through the whole gamut. I love Peterson Health because I can make a difference here. My voice is heard. I'm able to implement programs that benefit the patients that are beneficial to the providers here. So I feel that I can make a big difference at this institution, whereas I'm not sure if I were in a bigger place how easily my voice would be heard. So that's why I love to work at Peterson, because I feel that my voice and my presence makes a difference in the community.